Hello and welcome, everyone. I'm Erin Ryan from the Massachusetts Health Connector. I will be facilitating today's session. I'm joined by my colleagues, Nikki Conti and Seamus Kelly, who will be presenting today's information, and we are here to help answer any questions you might have. I would like to take a moment to thank elected officials across the state, including our partners in the state legislature and our congressional delegation, as well as chambers of commerce, business organizations, and brokers for their support in promoting this webinar. Before we get started, just some information about our presentation format. Everyone's audio has been muted and your video has been disabled. The presentation portion will last approximately 30 minutes. Then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A functionality. We will be monitoring your questions throughout. Please do not disclose any personal information or protected health information when you ask your question, as others on the call will be able to see what you've written. If you have a particular scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find help from navigators or a local broker. We are recording today's webinar. So following today's session, you'll receive an email with the presentation, so there's no need to take detailed notes. So we will go ahead and get started, and I will hand it over to my colleague, Nikki Conti.
Thanks so much, Erin, and thank you everyone for joining us today for this presentation. So this is actually one of the first times we're doing this high-level overview presentation where we intend to cover information for both individuals, families, as well as small businesses. So we're very happy that you were able to join us today as we orient you to offerings through the Health Connector. So there are 4 items here. We will start with an overview of the Massachusetts Health Connector. For those of you who are less familiar with our organization, we just want to make sure you have a sense of who we are and why we may be a great place for you to get coverage. I'll be going over some information about getting individual or family coverage, and then I'll be handing the session over to my colleague, Seamus Kelly, to talk through Health Connector for Business. Together, we'll go through some key takeaways and point you hopefully to some helpful resources. So with that, I'm going to keep going here through this slide just about our organization. So if you aren't familiar with the Health Connector, I just want to be sure that you know we are the Massachusetts marketplace for health insurance coverage. We're here to offer coverage for individuals, families, and small employers. We want to be able to provide access to affordable health insurance coverage and, more importantly, offer transparency in this process. As we've been working with many individuals, families, small businesses over the years, we know that shopping for health insurance coverage might not be something that you are really familiar with. So we really try to make this process as simple and as straightforward as possible for you. Now, a lot of folks who apply for coverage through the Health Connector get qualify or can get help paying for those for their coverage, and I'll step through some details around that so you know how and if you might be able to get some savings. It is also important for us to note that people can buy dental insurance through the Health Connector. I think when I'm always myself talking about health insurance coverage, but we don't want to forget the need and the importance of dental coverage. And then, as I mentioned, we do have a business offering, our Health Connector for Business platform. So very specifically, the audience for that are small employers with 50 or fewer full-time equivalent employees. So I won't say much more about that. Seamus will certainly be taking you through that section. So just a couple of things on this slide, a couple of details that I'd like to orient you to. So that as you're thinking about coverage, potentially getting coverage through the Health Connector, or just wondering more about this process, we want to level set and let everybody know that all of the plans that are sold through the Health Connector meet state and federal standards for coverage. So you never need to be concerned about the comprehensiveness of our coverage, whether or not somebody could be penalized if they in fact purchase coverage through the Health Connector. Again, all of our plans, whether you're buying on the individual, family, or small employer side, it all meets state and federal requirements. With that, all of the plans are known as qualified health plans or qualified dental plans. And depending upon where you live in the state of Massachusetts, there will be a variety of health insurance carriers who serve that area, which would be available to you. Now, moving into kind of the center or second column here, there's something called health plans with advanced premium tax credits. So I just want to describe that a little bit to you. On the individual and family side, people can qualify for tax credits, and that's the way in which their monthly premiums are reduced. So I'll get into that in more detail in a bit, but essentially more people now are qualifying for these tax credits based on recent legislation. So we want people to really know that this is in fact available to them. Now, unique to Massachusetts, we have what is known as a connector care program. The connector care program is available for people who are in lower income brackets, who meet other eligibility requirements and may qualify for a low or no cost health insurance coverage. Now, in the left-hand corner, we have catastrophic plans. Now, with the catastrophic plans, I just want to explain that that is available to people who are age 30 or younger or with a hardship exemption. So for that, I want to just, this is where I typically do my buyer beware. On the catastrophic plans, if people are looking at these plans and thinking, oh gosh, these are seem to be quite affordable premiums, just want to be aware that the premiums are lower each month, but at point of service, when someone is shopping for coverage, that is where you would actually be paying more. So just something to keep in the back of your mind. Now for dental plans, you can see here, we have dental plans available for individuals, children, families, small employers. And then lastly here, we describe Health Connector for Business. So Seamus will walk you through the plan structures that are available, and he'll also talk a bit about tax credits that employers may be eligible for, as well as the Connect Well Wellness Program for Health Connector for Business. Now, I mentioned that plans were available across Massachusetts from leading insurers. Here you can see all of the plans that are available, and again, either for individuals, families, as well as small businesses. So in this section here, I'm just going to talk a little bit more about getting coverage on the individual and family side. So if you're wondering, okay, who can apply, who should apply, because we're the Massachusetts health insurance marketplace, you need to live in Massachusetts. You need to be a US citizen, US national, or otherwise lawfully present in the US. And you need to not otherwise have access to comprehensive coverage. So for example, if you are offered coverage through your spouse's or your partner's employer, you would not be eligible for savings through the Health Connector. Now, in addition to that, if you are already enrolled in Medicare or the state's Medicaid program, Mass Health, or any other public health coverage like certain veterans benefits, you would not be able to qualify for savings because you're already receiving coverage through another government-sponsored health plan. So I also mentioned here, I talked a little bit about being offered affordable coverage from an employer, or if somebody is incarcerated. So again, you can easily see some very basic requirements and some very basic restrictions. Now, you may be wondering, when can I enroll? It is September right now. You may be thinking, okay, when should I start considering this process? So the Health Connector's open enrollment period begins on November 1st each year. However, if somebody needs health insurance, we don't want them to wait. So typically, if somebody is without health insurance coverage, it's very likely that they have some type of qualifying life event that allows them to enroll in or change health insurance plans outside of our annual open enrollment period. So when you're thinking about life events, think about things like changes to the size of your household. Maybe your income has gone up or down, or people have had changes in immigration status, or even moved to a different part of Massachusetts or into Massachusetts. So these are all examples of life events. Now, if you're in this situation, and you're looking for health insurance coverage, we would need you to report any qualifying event within 30 days of it happening. And then you have 60 days from the date of that event to select a new plan. And if you're in this process, you were required to pay a premium in order for your coverage to begin. All of the deadlines still apply, but basically a special enrollment period opens an opportunity for you to come in and get health insurance coverage with us without waiting for open enrollment. Now, you may be wondering, okay, how can I apply? There are 3 ways to apply. You can apply online at mahealthconnector.org. We also have our online application is available in Spanish. The website is similar, but with an addition of E and S. So it's mahealthconnector.org /ES/. So that's how you can apply online. And you are applying for coverage. That you can find out essentially if you could qualify for a Health Connector plan with or without help, or it may turn out that you qualify for Mass Health. The Health Connector and Mass Health are different organizations, but we share one application between our organizations. Now, what do you need when applying? You would need Social Security numbers for everyone, as well as immigration documents for any non-US citizen who's looking for coverage, and also income information. So if you are employed, we would need recent pay information, or if you generate income from another source, anything that you would put on your taxes essentially is what you would want to gather for this application. Now, I mentioned that I would talk a little bit more about these savings and how this really works. So for individuals and families, you may qualify for advanced premium tax credits. So these advanced premium tax credits lower the premium amount that you pay each month. The IRS sends your tax credit directly to the insurance company that you enroll in. So you just pay less each month. So your bill is less. You do not get the dollars and then have to kind of balance that out. Now, because these are advanced tax credits, you might find out that you qualify, let's say, for $300 a month or $400 a month of savings. And you may think to yourself, you know what, I don't feel comfortable. If I qualify for $400 in tax credits, maybe I know my situation might be changing towards the end of the year. Maybe I only want to use or apply $200 of that tax credit. You do have the option to do that with advanced premium tax credits. You do not need to apply all of that tax credit. And remember, these are tax credits. So at tax time, you need to reconcile what you've made that year, and you'll need to reconcile what you've paid for health insurance coverage, etc. So that's why it's important to be as accurate as possible as you're going through our application. Now, for the Connector Care program, I mentioned already that this is unique to Massachusetts. This lets people use federal advanced premium tax credits plus state dollars. Those two things together reduce the monthly premium amount that the person pays. So these plans are great plans. They're comprehensive. They have low monthly premiums, low out-of-pocket costs, and there are no deductibles. So depending on the plan type that somebody qualifies for, they could choose a plan for as low as $0 or even up to $134 per month. So again, great plans if someone is in fact found eligible for the Connector Care program. Now, I'd like to turn this over to my colleague Seamus to pick up on Health Connector for Business.
Great, thank you, Nikki. This is Seamus Kelly from the Health Connector for Business, and I'll be covering some slides on offerings for small businesses. Okay, so there are a number of benefits of businesses purchasing health insurance through the Health Connector for Business. We have the full carrier participation, which we showed a slide earlier of the different carriers here in the state. We have flexible employee choice models, which allows employers can let employees shop for different plans that fit their needs, all while keeping the costs constant for the employer. We have relationships with over 470 certified brokers. They're available to help employers navigate their decision-making process, and they don't cost employers anything. We believe we have offer peace of mind because all of our plans meet federal and state requirements. We have a wellness rebate where employers may be eligible for a 15% rebate on their premium contributions if their employees complete over 30 approved wellness activities. So that's a rebate that goes directly back to employers into their pockets. Competitive premiums, we see on average that small businesses save about 20% on premiums when they purchase through us, and that's for any of the rebates that are offered. So we have what's unique here at the Health Connector is we have an employee choice model, which allows employers to control their costs while providing multiple insurance options to employees. And we have 3 different models that allows employees to compare options and choose a plan that works for them. The first one is one plan, where an employer selects one plan and all employees either enroll or waive coverage. And this one includes our bronze offerings as well. But this is, in this situation, employer chooses one plan and every employee must either enroll or waive into it. Second option, which is one carrier, where the employer selects one carrier, meaning one health insurance company, and employees can shop among different plans that are offered within this carrier. And this is also where PPOs can be purchased on this model. And then the third model is one level where an employer selects a metallic tier and they're going to offer coverage on the silver or gold tier, and an employee can purchase from any of the different health plans on that tier. So if they offer a silver tier, employees can purchase from a silver plan based on all the different health insurance companies that we have offering. And at this point, I think about a third of the businesses are in one plan, a third of the businesses are in one carrier, and about a third of the businesses are in one level. It really sort of depends, what do they want to offer for their employees. One level offers probably the most options. One carrier is very popular because you can get the PPO, and one plan is also popular because that's sort of the historical way small group coverage has been offered. So Connect Well is a rebate program that businesses can qualify for if they have 25 or fewer enrolled employees and they buy through the Health Connector. To participate, employees can choose from more than 30 qualifying wellness activities. So employers can receive a 15% rebate on their contributions towards premiums. The average rebate as of 2020 was $2,900. If their employees participate in any of the wellness activities, the employees receive a $100 Visa gift card. And employers are automatically enrolled and receive email updates from us. They don't have to do anything. They can monitor the status of their employees and see whether or not they're going to get this rebate. But again, this rebate for businesses with fewer than 25 enrolled employees, this 15% rebate will go directly back to the employer's pocket. There's also a federal small business healthcare tax credit where certain eligible small businesses and nonprofit organizations that purchase through the Health Connector can get a federal tax credit that will offset some of the costs of their health insurance to their employees. The tax credit will cover up to 15% of an employer's costs, up to 35% for a nonprofit organization. In order to determine if you're eligible, you must have fewer than 25 full-time employees. Your average employee's salary is about $50,000 a year or less. You pay at least 50% of your full-time employees' premiums, and you purchase through the Health Connector. Now, to get more into the details of this, we do recommend that employers speak with their accountants to see how they would be eligible for this, but starting with just being offering through the Health Connector is the first thing, and then figuring out if you've got fewer than 25 employees and what your average salaries are, that would allow your tax credit preparer to help you see if you qualify. So we have over 470 certified brokers, and brokers are really helpful because one, they're free. They can help you navigate what plans might be the best for you. They can sort of explain how the plan designs work, can understand what your business is, what you and your employees would want from it, and they can direct you. They can save you a lot of time because the brokers already sort of know how to navigate the system and can figure out how to approach things in a quick manner. And they can also get you a quote. And they just need some basic information about the ages of people in your business, and they can run quotes for you. Nikki, I think this is you.
Yep, thanks, Seamus. So Seamus was describing how you can get some help on Health Connector for business side, but on the individual and family side, know that you can also get help through our customer service, but we also have these community partner organizations that I had started to mention before. So our customer service number is 877-623-6765. We also have a TTY number if anyone needs that assistance. But generally, if you're looking for customer service information, hours, etc., you can go to our website. But if you are looking for one-on-one assistance from a trained assister like a navigator, these folks speak many languages in addition to English. They can help you with anything from an application all the way through your coverage. If you go to our website, you can get to a link, and I believe it's under the Help Center. That is one of the quickest ways to find free local help. You can plug in your zip code or the name of your city or town, and you can see all of the organizations that have been certified to help you. In addition to finding navigators or certified application counselors on that page, you can actually also look for a broker there too. So please don't hesitate to go there and take a look and see who's available to help you in your area. So I am going to hand this back to Seamus to just talk a little bit more about some deadlines.
Sure, thank you, Nikki. So on the Health Connector for Business, we have annual open enrollment every single month. A business can come in and start an application with us, but we do have some deadlines. So for coverage that would start, say, on October 1st, businesses would need to come in and apply, enroll, and pay their premiums by the 23rd of the month in order for coverage to start October 1st. But before that, there are some key deadlines. So for an October 1st coverage, on September 10th, That would be the employer deadline to create an account, upload all full-time employees' quarterly wage documents, and select or publish a benefit package. And that starts the open enrollment for the small group. Employees must come in by the 20th of the month, and they would be able to create their accounts, enroll or waive their coverage if they have a valid waiver. And then the 23rd of the month is the deadline for an employer to make their first initial binder payment online in our billing portal. All of those things must be hit in order for a group to have coverage to start the first of the following month. Otherwise, it would roll to the month after. So the deadlines are pretty important, but we monitor all of our groups each month that are applying, and we're able to reach out to groups to make sure that they know they're up against the deadline, and we've got folks that will work with them to help them navigate these deadlines.
And Seamus, I apologize. There's one thing I do want to add here that I don't think I covered during my presentation, but I think it might be helpful to some of the folks who are on this call. So if somebody is a small business owner, but they do not have any employees, if they don't qualify to get coverage on Health Connector Business, let's say because they're a sole proprietor, I just want to point out that they can get coverage through the individual and family side. So very similar to all the deadlines Seamus was describing. Premiums are always due on the 23rd of the month. Coverage always starts on the first of the following month. So in this example, we've got everyone, if the person does their application, they choose their plan, etc., and they pay, their coverage will begin on October 1 if they took care of everything by September 23rd. Also important, if you're a sole proprietor, is that we are getting ready for another open enrollment for individuals and families beginning November 1. And Seamus, I think you mentioned this, but for Health Connector for Business, there is no open enrollment. Is that right?
Each month is essentially its own open enrollment. So businesses can come in and start coverage any month of the year. 12 months of open enrollment, if you will.
If we want to think about it that way. Okay, great. Thank you so much. So with that, Erin and any of our other colleagues, I think we're ready to take any questions people might have.
Excellent. Thank you so much, Nikki and Seamus. So again, just a reminder, please feel free to use the Q&A functionality to ask questions. Even as we respond to some of these questions that have already come in, please feel free to submit your questions, as some might spark other thoughts. Okay, so Nikki, can we, is it possible to maybe go back to the slide that talks about connector care eligibility based on income brackets? One of our questions is about income eligibility being based on federal poverty levels from 2021 instead of 2022, given our current year. But I think the heart of the question is, how is connector care eligibility determined based on household size and income? So I think if we can review there, that would be great.
Go to mahealth.org and go to the resource download center. You can choose a couple of different flyers, and you can see one is just on getting savings through the Health Connector, and the other one is just all about the Connector Care program. So in terms of requirements, I think we covered what the requirements were for just applying and getting savings. But the income requirements, if somebody, gosh, I don't want to, I think I can't share my screen. I mean, I don't think I can navigate there, but I will say, depending on a household income and somebody's household size, there is a sliding scale. And you may find that you in fact could qualify for a connector care plan. So the connector care income limits are anyone with income up to 300% of the FPL or lower. And again, if your family size goes up, then your income can in fact, of course, go up as well. And you might find that you qualify. The only other thing I might mention, because I think this is related and it's always kind of a follow-up question, and hopefully this will help that person, is that when kind of trying to figure out who your household is, I like to just tell people that you should just think about when you file your taxes, who do you include as part of your family, of your household. And that will give you a good sense of, quote unquote, how many people are in your household for our purposes.
Great. And so as noted on this slide, the breakdown of plans available, and if you're not eligible for connector care, maybe you can receive federal advanced premium tax credits.
You got it.
And there are, of course, navigators who can help with any, detailed questions that individuals might have related to their own circumstances. But outside of income, what are a few of the other kind of eligibility requirements for connector care, access to other coverage and whatnot that might, for lack of a better term, disqualify an individual or, make them ineligible?
Yep. So in terms of like something that could disqualify someone, if you worked for an employer and that employer offered you health insurance coverage, but you just chose not to take it, you wouldn't necessarily be able to enroll in our coverage and, apply and enroll in coverage and get these savings. So if somebody has an offer of employer-sponsored insurance, and it is considered affordable, and we have our online application has a set of rules. So there are some people who are offered employer-sponsored insurance and it's not technically considered affordable to the person. So you can do that. You can come into the application. We'll need you to enter some information about your employer, about the plan that they're offering, what your expected monthly premium would be, and then the system will do a calculation on the back end. And that's, I think that could help people think about their situation. Another thing that I thought of as you were asking the question, Erin, was people could find out, you can get an estimate of what types of savings you might be able to qualify for on the individual and family side, just from going to mahealthconnector.org. And in the far left-hand corner, there is an estimator tool. You just have to pick, like, if you're looking for coverage for an individual family or if you're looking for coverage for a business. And you can enter some very basic information and just get I don't want to say a quote, but just get a rough estimate of whether or not you might qualify for connector care program or advanced premium tax credits.
Excellent. Thank you, Nikki. And as you were referencing the resource download center, so people can look at kind of those income limits and to get an estimate tool, you might see in the chat, I put links to those to the resource download center and get an estimate tool in the chat for people to reference. And maybe if you click on them now, it might spark some more questions. So moving on, for individuals who maybe have had access to COBRA, are on COBRA, can they apply for the Health Connector prior to November 1st? Or how does open enrollment and COBRA, kind of work hand in hand in any way? Or how should someone with COBRA go about getting coverage through the Health Connector or finding out if they're eligible?
Yep. So COBRA in the Health Connector can get tricky, but it's not undoable. So we'll try to explain this to you. So the fastest path, if you know that you're losing access to employer-sponsored insurance and you will have access to COBRA, the rule is that you would need to enroll in Health Connector coverage before you take COBRA. However, there are some exceptions to this rule. If you are currently enrolled in COBRA and it's gotten expensive and you're looking ahead and our open enrollment begins on November 1st, when open enrollment begins for us, coverage starts on January 1. So if you are thinking about dropping COBRA, you can do that for the start of the new year. Otherwise, I don't want to say that you get locked in, but typically you are ineligible to get into a Health Connector plan with subsidies if you already are enrolled in COBRA. And part of the reason why I say typically, we have seen situations where somebody is in COBRA, but they're in COBRA, they decided to take the COBRA because their employer decided to give them a certain amount of money, or decided that they would pay for a part of that COBRA for a period of time. So if someone is in that kind of situation and they decided to take COBRA because the employer, or I'll just say it is being subsidized in some way, that person could in fact, once that subsidy ends, that person could in fact get into a Health Connector plan. So I hope that makes sense to the person who asked the question.
Thank you. So if someone's in COBRA, open enrollment is a period where they can shop, and the plan would be effective January 1. Otherwise, if they had subsidies either from an employer or elsewhere and lose it, that could potentially make them eligible to leave COBRA and join the Health Connector.
You got it.
Great, thank you. Can we just kind of review the difference between Mass Health and the Health Connector? So we share an application, but kind of what are the kind of high level differences between the two?
Sure. So high level differences. So Mass Health is the state's Medicaid program. At a high level, they offer coverage to people in Massachusetts who are in lower income brackets, who also could have one or another medical need. So for example, they have programs for women with breast or cervical cancer. They have programs available for people who are HIV positive. They also have programs for individuals with disabilities, as well as having programs for children. So there is I can't even begin to say that we're expert on Mass Health, but we are very close agencies. We work very closely with them, and they have a number of programs and offerings. Typically, there are no costs or no monthly premiums for Mass Health programs, but that is not always the case. There are also other Mass Health programs that help people pay their monthly premiums related to employer coverage. So I don't know, Erin, is there anything else you would add about Mass Health? Because there's a lot there.
There is a lot, and I would kind of just stress, it's a joint application, so sometimes that can certainly be confusing. Obviously, we're the Health Connector, they're Mass Health. Sometimes it's the Mass Health Connector. But I think there are certainly resources available for individuals once they apply and find out what they are eligible for, or even before they apply, they can seek assistance from navigators or certified application counselors if while they're going through the process they're confused. But I guess at the end of the day, if you need health insurance coverage, you don't need to know what you're eligible for. You can ultimately just complete the application, and if doing so online, would receive, in most cases, a real-time eligibility determination for either Mass Health or coverage through the connector, which leads me to kind of a subset of this question and just kind of a recap of what is the difference between the Health Connector and Connector Care, or rather, not a difference, but how is that structured?
Absolutely. Well, actually, before I answer that question, I wanted to answer say something that you just reminded me of. Because we share an application, if somebody applies for health insurance coverage through MA Health Connector, healthconnector.org, they're going to get notices from both the Health Connector as well as Mass Health. So I just like to say that so people aren't confused and wondering, like, why am I getting information from Mass Health or vice versa? If I applied for Mass Health, why am I getting information from the Health Connector? But I think I would stress for someone here, like, what's the difference, or how are these Health Connector plans that Nikki and Seamus were describing different than the Connector Care program? All of the carriers that we showed you offer commercial plans. They have coverage available, and different types of coverage. I know we didn't really share a lot of this information, but our coverage is organized into metallic tiers, and there's different premiums, etc., that are available. So if somebody is looking for coverage from a carrier, they can certainly just come to the marketplace. We offer transparent shopping. They can buy a health insurance plan for themselves, their family, or their small employer, not apply for any help, right? They can just simply buy this coverage off of our shelf. Now, if somebody is looking for some assistance paying for their coverage, they would complete an application looking for the savings. They could qualify for the Connector Care program. This Connector Care program, there are a subset of carriers who participate in this Connector Care program. The premiums are lower in this Connector Care program. And as you can see from this slide, low out-of-pocket costs, no deductibles, etc. Again, that's one way people can save money. Another way people can save money is just through these advanced premium tax credits. I probably shared too much information, but I hope that's helpful.
Thank you, Nikki. No, that's definitely helpful. That it is certainly, a program. Connector Care is a program within the Health Connector, but the Health Connector is, of course, here to serve all individuals, who, whether they need financial assistance or not. We have a question on whether or not the Health Connector will ever offer PPOs on the individual side.
I'm not sure that we are able to answer that on this call. I don't know, Seamus, you do have some PPOs on the Health Connector for business side, right? Is that right?
Yes, Nikki, we do on the small business side, but I can't really speak to the non-group at this point.
Yeah, we can look into that.
Great. Yes, a great question, clearly.
Yes.
And so we have another question, and I think we kind of answered it earlier, but just want to revisit it so that we can make that direct connection. Before going through the lengthy process of applying for coverage, how can a person see what they might be eligible for benefit-wise?
So if you go to mahealthconnector.org, in the upper left-hand corner of our homepage, you would want to click on Get an Estimate, upper left-hand corner. And then you would choose whether or not you're trying to get an estimate for individual coverage, family coverage, or small business coverage. And Seamus, I really can't speak to the Health Connect for business side, but are people on if they chose small business, can you describe a little bit about what they would see?
Sure. On the small business side, you can get your own quote by going into an employer section and just sort of, I believe it's called Quick Quote, and you can just put in some basic demographic information about your business's employees, and you would be able to see some quotes. But also you could work with a broker who could do a quote for you.
Okay, great. Thank you.
Excellent. Okay, and I also put a link to the Get an Estimate tool in the chat as well. So people can also access that if you weren't able to navigate it on the website. The link is there for you. And so this might be a question that kind of bounces back to me, but it was a question about kind of the income levels associated with the Connector Care program, and talk about the legislative approval for a Connector Care expansion. And so I'm happy to kind of take that and say that the legislature, of course, did send approval for an expansion of our current Connector Care program, which goes up to 300% of the federal poverty level, up to 500% of the federal poverty level. So that was ultimately unsuccessful, after it left the legislature and reached the governor's desk. But, we realized that it has gained, attention, support, and traction. So we will just continue to monitor any additional action on that front. So, the very well-informed individual that asked the question, we are certainly, keeping an eye on any, additional action on that front.
And Erin, if it's helpful, I was thinking that, and thank you for explaining that. I think that's really helpful for people to understand. I know we have a variety of folks on this on this webinar. We're not sure where folks could be coming from with any background, any interest in this topic area. But I wanted to just show you quickly the Resource Download Center and show you, Erin, if you could just confirm you're able to see that.
I can, thank you.
Okay, great. So if I go to the Help Center and I click Resource Download Center, there are a couple of different tools here. Actually, this is a good one also to mention. This is a tool if someone's recently lost coverage. I think this is a great flyer to take a look through. And then we have some shopping guides. I could keep you on this webinar for a long time. I won't do that to you folks, but what I will do is really try to encourage you to, go to our website, look around, poke around, regardless of, what kind of coverage you're looking for, and just, look at this information. If you have questions, please don't hesitate to reach out to us. But I wanted to share this information because I talked about this in very high level terms. There are FPL guidelines. We have household size listed on the left-hand side, and we are, the Connector Care plan is broken up into different plan types, and that's going to be dependent on the household income. And then as you can see here, for those over 300% of the federal poverty level, they could, in fact, you still could, in fact, qualify for some tax credits to help you save on your monthly premium.
Great, thank you, Nikki. And I believe we just have one last question, and this is just really about kind of coming up to the 2023 plan year. And so Connector Care income guidelines, like you're showing us here for the current plan year, when will somebody be able to see those guidelines for 2023? Is that something they can access now, or does that become available during open enrollment?
The FPL guidelines change each year. They change in the spring, actually. When looking at plan year 22, we use the 2021 federal poverty level guidelines. When looking at plan year 23, so plans that begin on January 1, we use the 2022 FPL guidelines. So if anybody is looking for the 2022, I would suggest just doing a little Google search on mass.gov, and you'll be able to get that information.
Great, excellent. Well, thank you, Nikki. That is all of the questions that we currently have. So just, before we sign off, just want to remind folks, our open enrollment period, again, it begins November 1st. So that's when individuals can come in, begin looking at what they're eligible for 2023, and all coverage would start January 1 for open enrollment, but you would have to make that payment and plan selection by December 23rd for January 1st coverage. But Nikki, I'm not sure if there's anything else you want to leave our guests with today.
No, I mean, I think we had a variety of great questions. Maybe I'd want to leave them with, although we have an open enrollment period on the individual and family side, as Seamus said, it's open enrollment all year long for Health Connector for Business. So that's all I've got from my side. I just want to thank everyone for joining us today.
Well, thank you so much, everyone, and be safe and take care.